I'm Tamaria Mitchell, and this is my week 3 lab video.
I'm Smithy Banks, and I give her permission to record me. Come in.
I'm performing hand hygiene, putting on my gloves. Hello, Mr. Banks. How are you?
Good. How are you?
I'm doing good, thank you. I'm Tamaria Mitchell. I'm a student nurse at Chamberlain University, and I'll be doing 2 assessments on you today.
Okay.
I'll be doing hair, skin, and nails, and as well as head, face, and neck. Is that okay?
Yes.
Good, thank you. It'll take about 5 minutes tops. That's all. So we'll start with hair, skin, and nails. I need to ask you a couple questions. Do you have a history of cancer?
No.
Skin cancer in particular?
No.
No? Okay. Do you have any exposure to the sun? Do you stay in the sun a lot? Alrighty. But when you are in the sun, do you use sunscreen?
Yes.
Alright, high five. That's good. Okay. So we'll start with the skin. So I'll look at you. Your skin tone is pretty appropriate for your ethnicity. I don't see any pallor, which is sign of paleness, or cyanosis, which is blue. Arrhythmia would be red, and jaundice would be yellow. I see no signs of that, so we're in good. I'll feel your skin with the back of my hand just to see your temperature. Your skin is warm and it's dry, and as well as I notice your skin is thin and it's also smooth, which is what we want. The only thick skin would be present is on the palms of your hands and the soles of your feet, which we have, so that's good. Okay, so next thing we'll do is your skin turgor. So turgor and mobility is when mobility is the ability for it to rise, turgor is the ability for it to snap back, which is yours pretty quick, so that's good. Alrighty, and then we'll scan you, see any lesions or like moles or anything. I do see small little macules that you have on you, which is normal. They don't raise any suspect. You do have a raised one that's larger and darker than the others on your chin, which is not a really big deal. As long as it's less than 6 millimeters, it doesn't raise any questions. But I would like you to go home and keep an eye on it. Once a month, just follow A, B, C, D. A is asymmetry, so you just look at it, make sure it says symmetrical. B, make sure there's no form of border around it or anything like that. That raises questions. As well as C, color. Make sure that, did I say it again?
Yeah.
Oh, okay. C is make sure it stays dark brown. Make sure it doesn't get like a disarray of colors like tan or any red. And then D is the diameter. Make sure it just stays that size and it doesn't get any bigger. Okay? Alrighty. Next thing we'll do is your hair. So I'll just finger and sort out your hair around just to look at your scalp. I'm not seeing any lesions or discoloration or any signs of lice or anything like that. So your hair is good. It's nice and clean. And then we'll check your nails out. So your nails, pretty rounded. Your nail bed is pink and it's firm. It's not sponge or anything like that. And as well as we'll check your capillary refill. So we'll like pinch the little finger a little bit and let it refill up. And your capillary refills within 2 seconds. So that's normal and that is good. Okay, so the next thing we'll move on to is the face, head, and neck assessment, okay? So with that, have you had any pains in your face or jaw or anything like that?
No.
No? Any pain with your thyroid, throat pain or anything like that?
No.
Hypothyroidism, hyperthyroidism?
No.
No? Okie dokie. So we'll check your face. First thing we check with face is your symmetry. So what I'll do is I'll look at your eyebrows, your eyes, your lingual folds, or labial folds, sorry, and then the ends of your mouth. And they look pretty symmetrical. They're all lined up. You can look at me. They're all lined up, so that's good. If one side was drooping, it would show signs of stroke or something like that. But we don't have to worry about that because you're all good. So next thing we'll do is I'll give you a little head massage because I'm going to palpate around your skull. And use 2 fingers and work around just to check and make sure I don't feel any indentation, lumps or bumps. Nothing in that sort. And it's feeling pretty normal to me, so that's good. Next thing I'll do is I'll move down, I'll check your TMJ. So that's right here. So I'm gonna put my fingers right here and I want you to open your mouth like this. Yep, you got it. And just open and close, open and close. Yep. All right. Doesn't hurt or anything like that?
No.
That's good. The next thing I'll do is check the glands, make sure there's no swelling. So kind of keep like a straight face. I see no parotid swelling, parotid gland swelling. Then look up. I see no salivary gland swelling, nor thyroid gland swelling. Kind of rub my finger up your throat. I know it tickles, sorry. Alrighty, that's good. So next assessment we'll do is we'll look at your lymph nodes. There are many of them, but it's fine. I'll use 2 to 3 fingers, rub in a circular motion with my fingertips just to feel. A good thing is if I don't feel them, that means we are fine, they're not swollen, there's no signs of infection. If they are, then we'll do a further assessment, okay? So the first ones, I want you to turn towards me. First ones, preocular, postocular, occipital, the back of your head. Then we'll do under your chin, which is submental. And here, submandibular. Then on that corner is the jugular digastric. I'm not feeling anything. Then we have, oh wait, nope, alrighty. Then we have superficial cervical. We have a deep cervical chain, so we'll go down the neck with that one. We'll kind of use 3 fingers to feel. Then we'll have posterior cervical, which is in the back of the neck. And then I'll ask you to shoulder, little less down. And we'll check in here for the subclavicular. And I'm not feeling anything. All right, so that is good. Okay, so next thing we'll do is check the range of motion of your neck. So I ask you to look left, look right, up, and down. All right, and then last but not least, you can look back up. Last but not least, we'll check make sure that your cranial nerve 11 is functioning correctly. So I'm gonna ask you to put your ear to the shoulder, and the other one, and then I ask you to turn, looking good, and then you turn your face in towards my hand, and the other one. Okay, Mr. Banks, that is good. I see nothing, anything we knew, any further assessing. This was really good. So, thank you. Hope you have a good day, and I hope you do as well, and thank you for watching my video.